new study found social media use among American children and teens increased by 17% over the last 2 years. A Pew Research study shows that 21% of parents with kids under 11 years old reported their child used TikTok. That's up from 13% in 2020. And the use of other social media sites nearly doubled in the last 2 years, from 8% to 17%. For more on this, I'm joined by Dr. Warren Eng. He's the president of the American Academy of Child and Adolescent Psychiatry and a professor of psychiatry at Columbia University Medical Center. Dr. Eng, welcome. Thanks very much for being here to talk about this. It's a really important issue. And, you look at that time frame and you think the pandemic, that would seem to be what might account for this increase. Why do you think kids are spending more time than ever on social media?
Thank you so much for having me. I think this is such an important topic, and thank you for spending time on it. I think that this is really happening from a number of different reasons, and we can appreciate that the pandemic has definitely really turned the world upside down for young people, but social media is definitely in the mix. So when we appreciate that suicide continues to be the second leading cause of death for young people, as well as the fact that there's been a 70% increase in suicide, we definitely appreciate that kids are really dying because of what's going on. And there's also been a national state of emergency declared by the American Academy of Child and Adolescent Psychiatry, the American Academy of Pediatrics, as well as the Children's Hospital Association. And as a child and adolescent psychiatrist and a physician expert in children's mental health, this is something that I see every day. And it's really heartbreaking to see the impact on our children and adolescents, as well as the families who suffer with them.
We've seen these mass shootings in the headlines. Social media has often been linked to mass shootings. We've seen shooters, for instance, post messages on social media before carrying out their attacks, and some have even been live streamed. How could this type of content impact children?
I think it's horrifying for children, and it adds to the trauma that they're already experiencing. And I think one of the challenges with social media, not only because it's often used as a platform or a motivator for some of these horrific tragedies, but just the fact that they continue to live on. And for children and adolescents who are already struggling with so many issues, such as mental health issues, which has been on the climb during the pandemic, one of the challenges is that they're actually increasingly exposed to more extreme content, as well as the fact that it's also designed to keep young people on their devices, on social media, for longer periods of time, not really respecting the fact that they need to sleep, they need to take care of themselves, they need to interact with other people. So I think that social media definitely has a role to play, as well as the need for accountability when it comes to taking care of our young people.
So given those factors, doctor, how can parents minimize the potential harms of social media for their children?
I think parents can do a lot of things. And if you have the privilege of having a young person in your life, the most important thing is to ask them, how are they doing? And really being open to hearing that it might not be good. And the fact that 44% of adolescents at this time in a high school survey, demonstrated that they were hopeless and helpless or sad for a prolonged period of time. And we see that even in another high school survey, 20% of adolescents were thinking of killing themselves, and 9% of them actually attempted to take their lives. So for parents, this is really life-saving by asking simple questions and engaging their youth in finding out what's going on with them. I often say to my young people that, before you start going on social media, as well as the moment that you stop, ask yourself, do you feel better? Do you feel better about yourself? Because I think a lot of the things that are really challenging about exposure to ongoing social media is that it isn't always giving young people the content and the information, as well as the affirmation that they need. And we definitely see this in terms of suicide, in terms of eating disorders, even in terms of body image issues. And there's one study that was looking at adolescent females, and they had 32% of them had a worse version of themselves even after exposure to social media. And we need young people to feel better about themselves and to know how important they are. And those are not always messages that are often found in social media.
Social media platforms will point to things like parental control sort of measures as, an opportunity for parents to then go ahead and have some intervention. But how useful, in your view, are those kinds of measures?
Those measures are only as useful as parents have the time as well as the digital literacy to really appreciate that. So I think that that's why it's really important that the National Academy of Sciences, Engineering, and Medicine is really coming out with an assessment on social media health and well-being. And some of those tools that hopefully will be developed will also help parents navigate really an evolving terrain, and it's hard enough to keep track of your kids. Well, it's even harder to keep track of all the things that are going on in social media and digital media. So I think that one of the things that I mentioned before is that it's so important for parents to ask the questions, but also to get informed, as well as to appeal and advocate to lawmakers, as well as their congressional delegates, as well as their policymakers, in terms of what safeguards can we put into place to protect young people so that it's not just on the parents' responsibility, but it's on everyone's responsibility, particularly the digital media companies and the industry that is benefiting from a lot of these issues that are unfortunately at the risk of our young people.
Because as you point out, Doctor, it is an evolving landscape. As the technology evolves, it's very difficult for parents to kind of keep up. Really important information. Dr. Warren Eng, thanks so much for coming in to talk to us. We appreciate it.
Thank you so much.